So today we're going to talk about a situation that is all too familiar to us. Food poisoning. The agony, the stress, the pain, the cramping, the nausea, the diarrhea, all the GI symptoms packed into one. But don't worry, in this video we're going to discuss what exactly causes food poisoning, how do you know if you have it, and most importantly, at the very end, I'll discuss my recommendations as a GI expert to get this taken care of. If you're wondering, oh my gosh, what is going on in my gut? Am I poisoned? This video is for you guys. Let's talk about poop. Howdy y'all, Dr. Islam here, aka your poop guru and gut microbiome expert. I'm a board certified gastroenterologist trained at the Mayo Clinic. Come see us at Gastro for all your GI needs. And don't forget to like, share, and subscribe to get more videos just like this. So what exactly is food poisoning? So simply put, food poisoning is when an unwanted substance goes into your body from eating or digestion that your body just cannot metabolize, cannot get rid of, and causes havoc inside your GI tract. Now this can occur whether you ingest an unwanted parasite, virus, or bacteria. You ingest this or drink this, and all of a sudden your body's like, oh my goodness, what the heck is going on? I need to do what I can to get rid of it. Now the most common reasons why you can get food poisoning is eating foods that are not cooked properly, they're not stored properly, or you're cooking foods in an area that's not very clean, or you're eating foods that's left out too long. You know that rice that's been sitting outside the refrigerator for days and you're eating that? That is a prime source of food poisoning. Now there are a lot of bacteria that can cause food poisoning, but the most common one is called Campylobacter. This is commonly acquired by having uncooked or raw poultry or eating food that has touched that. Now there are other causes or bacteria of food poisoning, including E. coli, very common in really poor meat or hamburgers that are not cooked correctly, or even salmonella as well. So how exactly do you know if you have food poisoning? Well, I can tell you probably know because you're having the terrible symptoms that can occur with this. Sudden onset of nausea, vomiting, diarrhea, abdominal pain, cramping. All of a sudden it just hits you. It's like you're having Montezuma's revenge. In fact, literally, that's exactly what happens. Your body is attacking what's going on inside your body. So you have these very sudden symptoms. Now it can occur hours after you eat this food, but it can even occur days after you eat these foods that are typical for food poisoning. So if you're worried that you're actually having these issues, it's important to make sure you get checked out to find out what's going on. So let's say you're in this scenario where, oh my goodness, I'm being poisoned by food. What is going on? What can you do to get your symptoms taken care of? Here are tips that I recommend as your poop guru. Tip number one, most important, stay hydrated. You are going to lose fluids, so make sure you stay on top of the hydration. Drink water, have Pedialyte, have things with electrolytes. This will give you the nutrients that you need to make sure you can replenish what you're losing. In fact, if you get to the point where you're not being hydrated enough, or you feel like, oh my goodness, I cannot take enough liquids, this is the time to go see a doctor or go to the emergency room to get some fluids and make sure everything's doing okay. So what should you eat if you're having food poisoning? Aim for bland foods or the BRAT diet. That includes bananas, rice, applesauce, and toast. Guess what? Clinical evidence does suggest that having the BRAT diet can help out when you're having food poisoning. So use these foods as a way to help heal your gut and improve your gut microbiome. Now it's also important to stay away from foods that make your symptoms worse. So things like alcohol, caffeine, dairy, carbonated drinks, spicy foods, and fatty foods. These things will wreak havoc on your gut and make things worse for your GI tract. And in certain cases, over-the-counter medications can help out, especially the symptoms like nausea, diarrhea, and abdominal cramping. Anti-diarrhea medications like Imodium, Pepto-Bismol, these things actually help out and can help control those symptoms. If you're having nausea, things like ginger or peppermint or chamomile tea can actually help out with the nausea as well. If you're having cramping in your belly, peppermint tea, chamomile tea, these things can help out with the cramping as well. However, if your symptoms do become severe to the point where it becomes debilitating, always make sure to talk to your doctor and see a doctor ASAP. Lastly, but certainly not the least, don't underestimate the importance of rest. Your body is trying to attack itself to get rid of the toxins that are there. So your body also needs rest. Rest is so critical when it comes to recovering from food poisoning. Don't go out and work out. Don't go out and go to your work if you can't help it. Stay at home, relax, rest, and take care of yourself because your body needs that rest to get you feeling better. Now, most cases of food poisoning can be treated at home. However, there are certain things you need to kind of keep an eye out for in which this would necessitate immediate medical attention. So if you already have a weak immune system, so for example, you're taking chemotherapy, you're on steroids, or you have some sort of weakening condition, always be hyper vigilant about the symptoms that you're having, because any typical food poisoning that I may get because I have a normal immune system may be 10 times worse for somebody who already has their immune system compromised. So if you have that, or if you're in that situation, I would have a low tolerance, go see a doctor. If you are pregnant, not only are you taking care of yourself, you're taking care of your baby. And so anytime you're pregnant and you have these symptoms, always go see your doctor. Number 3, you have confusion. If you're vomiting so much, having so much diarrhea that you're so weak and confused, this is not normal. This is not part of the normal spectrum of food poisoning. Go see a doctor or go to the nurse emergency room. If you have severe dehydration, you can't keep up with the fluids, you're peeing yellow or you're not peeing at all, that is a sign you're volume depleted, and get help. And if your symptoms don't get better after a couple of days, it may not be food poisoning. There could be other things going on, so make sure you see a healthcare professional to get checked out. And there you have it, my full comprehensive guide on what you need to do if you're getting issues or symptoms of food poisoning. If you found this video helpful, don't forget to like, share, and subscribe. And don't forget to come see us at Gastro for all your GI need. Look forward to seeing you guys on future videos.